Treatment of crown hair loss. In recent OPDs or in recent times, there have been an increase in people coming to us for crown hair loss. Crown thinning is becoming more and more common and people are more worried about it, be it of any age group. So starting from 18 to 20 years of age till 50, 60 years of age, there have been so many people who are coming to us for crown hair loss treatment. So we thought of educating you regarding management of crown hair loss, whether it is medical treatment or surgical treatment, then planning, then complications of surgical treatment, and then densification of scalp without surgery. So in the present video, let us discuss everything about planning and execution of crown hair loss. Later, we will be coming to you with a management of normal 1 to 7 degrees of hair loss. So let us start today's discussion. My name is Dr. Preeti Saraswat, and for more such educational videos, subscribe to this channel. So what can be the reasons why there is thinning of hair over crown? There could be congenital reason, like there is thinning of hair from birth. Then there could be some trauma or burn from the crown area so that there is loss of hair. But the commonest of all is obviously androgenetic alopecia or male pattern hair loss. So when you come to us with a problem of crown thinning or crown hair loss with thinning of hair either in the front or only crown, then we first do a proper consultation with history and family history. So in that, the important thing is your age, whether you are young or you are middle-aged or you are towards the older side, and also whether you have taken medical treatment or not. Then the first thing to be done from our side is trichoscopy or dermoscopy so that we understand the nature of thinning, the diameter of hairs if you have any on the crown, then the donor side characteristics and the characteristic of rest of the hair on the recipient side. So if you are younger age group, then the best would be medical treatment for you, the details of which I'll be very soon covering. Then if you are more than 30 to 40 years of age and you have isolated crown, then you are optimal candidate for hair transplant. If you do not have isolated crown, you have hair loss in the anterior, frontal and mid scalp also, then we need to sit down, do a proper consultation and then decide how much area should be transplanted. So in the next sections of the video, we'll be covering the surgical part and the medical part one by one. Do press the like button and then we'll move further. When you come for consultation for crown thinning or crown hair loss, usually what we do is we try to assess how many grafts you have lost. And then depending upon your age, if you are in 20s or you are in early 30s, we try to give you medical treatment only. There is a very important reason for it. Number one, the hair roots at the crown respond very well to finasteride and minoxidil. Number two, the curvature of the crown is such that the hair are in a whirl pattern. They are rounded shape. They are coming out in an angle and direction like a whirl. So, if you go for a hair transplant, we try to put many grafts in it, but still, because of the whirl pattern, the scalp is almost always visible because of the curvature of the crown, like it is going straight from front and then it goes down. So, this curvature along with the whirl and the crown is usually seen from top. So, the scalp is usually visible, and patients in 20s and 30s, they do not like that. They want their crown to be very dense. So they want to get another session for that. But mind you, we cannot keep on filling grafts in the crown because then you will be losing all your donor site in the crown itself, and then we will not be having enough grafts to cover your front and mid scalp when it is required so much. Whenever there is a person who has lost his hair in the front and top and crown, if you fill the front and the top first, the result would be very nice, very good as compared to the crown. Therefore, medical treatment for the crown is a must. If you have any confusion in this or you want to understand it more, please write your question in the comment section below so that we can have a chat, or you can call us for consultation on the numbers given so that we can speak to you and we can make you understand better. Coming to the surgical treatment of crown now. How do we go about hair transplant in crown? As we all know, it is slightly tricky because of the whirl pattern. So we have to find out a way in which, taking minimum possible number of grafts, we are able to cover maximum portion of crown, because as we know, crown is said to be a black hole of surgery. It can keep on eating grafts and still the scalp will be visible. So there are usually two ways followed to cover the crown. One is the anterior crown is grafted nicely in a pattern which is visible by the small number of grafts still left there, or we can make a pattern anteriorly so that when those hair grow, you are able to comb them back and the rest of the crown is covered. By this, a very important complication is avoided. The complication is halo effect. So once you do whole of a crown, if you do whole of a crown, and then because crown is ever expanding, it keeps on expanding further, then what will happen? The grafted hairs will be in between, and around them there will be halo of bald area. This will look very odd. So to avoid this, we grafted the hairs in the front so that even if it expands on the sides downwards, we are able to cover it by the grafted crown, the anterior part of it. Number 2 method is we start the grafting from the circumference and we do a low density crown, making it even less dense towards the middle. So in this way, we bring an optical illusion that the crown is there, but it is very less. This is again one of the methods by which with less number of grafts, we are able to cover the crown nicely. One important thing is the more black your hair is, the more grafts you would be requiring for densification and less visibility of scalp. In order to make the scalp even less visible, I would be discussing another method very shortly, but covering the surgical method first. These two methods are of so much importance that we need to see, we need to make ourselves believe as a surgeon that whatever the grade of crown thinness or baldness is, we have to consider that this is grade 7 and we have to think about how we would transplant if you were grade 7, because eventually if you are in your 20s or in your 30s, you would go to a higher grade and then we would be needing more graft for your anterior areas and maybe a second session for crown also. That way, long-term planning and treatment is very essential, and do sit and consult with your doctor before you actually jump to hair transplant surgery. If you want to understand why crown hair transplant is toughest, click on the video link above and then you will be able to understand much better. Now suppose you have taken medical treatment for certain duration and then you wanted a transplant also, so you have done transplant also. Still you feel, as many people feel, that the scalp is still visible. So now scalp micropigmentation comes to rescue. What we do in SMP is we create miniature medical tattoos like budding hair follicles. So they give an optical illusion that more and more hair is coming out and thus the scalp visibility is reduced to a minimum. SMP is a medical way, non-surgical way to make the scalp less visible without any surgery, and also you can get it done. If it fades in 3 to 5 or 8 years of time, you can get one fresh session done and then you are okay to go. So this is a very beautiful method. You can always consider this for crown area. Do share this video with your family and friends who are in need of crown hair transplant. If you want to know more about scalp micropigmentation, how it can help you, click the video on the left, and if you want to see a testimonial of a crown hair transplant patient, click the video on the right.